So I mainly teach on the Masters in Public Health, which is great because you get lots of brilliant people from different backgrounds, many of whom got a medical degree already, or many have worked in the field for 10 years or more. The Masters in Public Health is studied by everyone who goes on to become a public health consultant in England as part of their training. But this can also be daunting, being around all these brilliant people, because the collective knowledge and wisdom of the students will always be much more than what I know, so I need to recognise that I need to be more like a learning facilitator really than a font of all knowledge. So far the way I teach has been trying to give people lots of nuggets of information so that no one who comes to my session leaves without learning something new. I always joke that my teaching method is death by PowerPoint, because sometimes I'll have 100 slides a session or more. But lately I've been wondering if that's the best way to teach. Are all my slides necessary, or am I using them as a defence mechanism or a safety net? And does having all of these nuggets come at the expense of having depth? I feel like I've become more confident with my teaching, but at the same time less certain, because when I started about 10 years ago, I only really knew one version of the truth. Now my thinking has become much more nuanced, but I'm scared of this leading me down lots of dead ends, all of this different details that I can come up with. If we read a book or watch a film, we want it to have a narrative, a start, a middle and an ending. And I was wondering if I could try to tell a story a bit more with my sessions, make it more personal, more authentic, teach the material but sneak it in as part of a story. Having a narrative might help me to tie my teaching together and decide what to include. So I decided to tell a story based on health inequalities. I invented these two characters called Paul and Rich, who were born on the same day in Liverpool, and used their pen portraits as a way of challenging the students to think about how health inequalities accumulate over the life course, and at what points could public services intervene to make them healthier. I wanted these characters to come alive, to be three-dimensional, real people, and their stories were partly based on people that I knew. I told their story and prompted the students to think about what caused the differences in health between the two men. Was it factors like education, early life factors, employment, income, maybe lifestyle risk factors like diet and smoking and alcohol? I was a bit worried about it being seen as a bit kind of corny or judgmental, but when I tried it out, I think this activity worked well in making my teaching more authentic, and health inequalities stopped being this abstract thing and started being about different people's life chances and their stories. And it made me think that next time I'm teaching, it can help to start with the story to bring it all together. And then maybe after that I can still add the 100 PowerPoint slides.